My name is Rachel Byrne, and I did my speech on the healthcare reform. Did you vote in the last presidential election? Are you happy with the outcome? Are you happy with the changes the president is making when it comes to the medical field? Did you know that 52% of Americans are not happy with the new Obamacare? Which side are you on? Your opinions might differ based on your income or your career choice. The advantages and disadvantages of Obamacare has been stated many times when it comes to the average citizen, but it hasn't really been talked about when it comes to nurses who are actually in the medical field. As a pre-nursing student, I'm very interested in this topic and have read several articles pertaining to it. I'm going to discuss with you how nurses are going to be expected to fill in the gap in the medical field, how they're going to be expected to open their own clinics, and how they're going to be a huge change in the number of nurses we have. According to an article by Fierce Healthcare, many organizations are looking to the nurse workforce to help close the primary gap and meet the rising demand for healthcare services. With this new Obamacare, there should be about an increase of 20 million new patients coming into the field. Many nurses doubt their abilities to be able to compensate for them. A lot of nurses are planning on retiring also, which means that the number of people we need to help all these patients is going to increase greatly. And according to an article by Public Health Management, nurses are going to be expected to run their own clinics by themselves, without primary physicians. Clinics will help the minorities and those in poverty get the health care that they need. These clinics will also be for patients who don't need ongoing health care, that they only need to stop in once and get what they need. These clinics will also be used to teach. Nurses will teach disease prevention as to stop people from needing to come back. And lastly, the number of nurses we have will change dramatically. With this new healthcare bill, millions of people will have access to medical care that they would not have normally received. Also, there is a huge number of nurses planning on retiring. There will be such a shortage of nurses that will be many scholarships and shortened school programs to allow for more people to get the education they need to enter this field. According to an article labeled Impact of Obamacare, it is projected that there will be 1.2 million job openings for licensed practical and registered nurses that will need to be filled by 2020. This just shows that this is such a great time to enter the workforce because there are so many job opportunities becoming available. As I wrap up my speech about how healthcare changes are affecting nurses, I hope you take what I've told you and apply it to how it could affect you. I would like everyone to know, especially nursing students, how the healthcare bill is going to affect them. Today I've shared with you how nurses are going to be expected to fill in the gap in the market, how they're going to be expected to run their own clinics, and how the number of nurses we have will change dramatically. Thank you so much for your time.